Hello, my name is Analeslie, and I'm joined with Sung Mi and GaYeon. We are third-year pharmacy students from the Daniel K. Nguyen College of Pharmacy. And for today's health webinar, we will be presenting to you, Let's Be Fast to Prevent Stroke. We also wanted to thank Dr. Nicole Young for her guidance through this webinar. Today we will discuss what is stroke, what causes stroke, what are the signs and symptoms of stroke, treatment of stroke, and how to prevent a stroke from occurring or reoccurring. So what is stroke? There are different ways in which a stroke can happen. If a blood clot or plaque is involved, then it would be an ischemic stroke. If there is a bleed, then it would be a hemorrhagic stroke. The moment you have a stroke, the brain cells will start to die due to the lack of oxygen. Therefore, it is important to seek medical attention right away in order to prevent brain damage and long-term disability. An adequate supply of blood and oxygen is crucial for breathing, digestion, body movements, memory, emotion, and language. Here are some facts about stroke that we would like to highlight. 1 in 6 people will have a stroke in their lifetime. High blood pressure is one of the leading causes of stroke. Up to 80% of strokes can be prevented by keeping a healthy lifestyle. Stroke is a leading cause of death for people over the age of 60, but there are 26 million stroke survivors. This graph represents the stroke death rate of people living in the state of Hawaii. As you can see, the likelihood of dying from a stroke has significantly declined due to the improvements in stroke care and prevention of stroke risk factors. Here we wanted to show you how the majority of deaths occur in the population over the age of 70, with a significant risk for those over the age of 85. We will now discuss the different types of strokes. There are 2 different types of stroke, ischemic and hemorrhagic. A transient ischemic attack, also referred to as a TIA, is a temporary period of symptoms similar to those of a stroke. I'll be going into more detail in the following slides. A TIA is often due to blood clots, which display signs of a stroke. If you're experiencing signs and symptoms of a stroke, it would be difficult to distinguish if it's a TIA or a stroke. The main difference is that a TIA will resolve by itself, but it should still be treated as a medical emergency, and you should still call 911. Experiencing a TIA is a warning sign of a potential stroke in the future. An ischemic stroke can occur from either plaque buildup, which would be fatty deposits blocking the blood from going up to the brain, or a blood clot that was formed in the body and traveled up to the brain. We will discuss specific medical conditions that can put you at risk for this type of stroke. A hemorrhagic stroke can happen when a weakened blood vessel in the brain ruptures and blood starts to build up, damaging the surrounding brain tissue. We will now discuss what can cause a stroke. Lifestyle factors, family history, genetics, medical conditions, and medications can all contribute to cause a stroke. Having a poor diet, smoking, heavy alcohol use, and obesity can put you at risk for both an ischemic and hemorrhagic stroke. People are also at risk for an ischemic or hemorrhagic stroke if there's a family history of stroke, if they are over the age of 55, an Asian and Pacific Islander, Hispanic, or African American. Men are more likely to have a stroke, but women are more likely to die from a stroke. This is why stroke prevention is really important. Having high blood pressure is the most important contributing factor that can lead to both an ischemic and hemorrhagic stroke. Having atrial fibrillation, high cholesterol, diabetes, heart failure, and other heart diseases like heart myocardial infarction, also known as a heart attack, or left atrial enlargements would put you specifically at risk for an ischemic stroke, while having a brain aneurysm, cerebral amyloid angiopathy, which is a condition where proteins build up on the walls of the arteries in the brain, would put you at a risk for a hemorrhagic stroke. This study showed that as a person's systolic blood pressure increases, the risk for hemorrhagic and ischemic stroke also increases significantly. For example, if a systolic blood pressure is at about 150, there is twice the likelihood for a hemorrhagic and ischemic stroke. This other study looked at the main contributors for stroke in men and women. And while there are several factors like high cholesterol, obesity, diet, physical activity, alcohol and cigarette use, the highest contributor was high blood pressure in both men and women. Moving on to medication-related risk factors. Using illicit drugs like methamphetamine and over-the-counter medications like Sudafed can increase the risk for both ischemic and hemorrhagic stroke due to these medications increasing blood pressure. Hormonal agents like estrogen and testosterone, cancer agents like raloxifene and tamoxifen, and other medications such as selective estrogen receptor modulators, or SERMs, and Epitin can significantly increase the risk of an ischemic stroke. Medications that can increase the risk of bleed and consequently hemorrhagic stroke would be anticoagulants such as warfarin, antiplatelets like aspirin, and NSAIDs like ibuprofen, also known as Motrin.
As we mentioned earlier, atrial fibrillation greatly increases the risk of stroke. Atrial fibrillation, also known as AFib, is the most common arrhythmia with irregular and rapid heart rhythm that can lead to blood clots in the heart. In AFib, blood is not pumped efficiently from the heart, so the blood pools and gets stuck in the groove of the heart and forms clot. This blood clot can be carried by the blood flow and travel up to the brain to cause blockage in a small vessel and causes an ischemic stroke. High blood cholesterol also can cause a stroke. This fat in the blood can build up plaque anywhere in the blood vessel in the body. If this happens in the artery in the brain and blocks the blood flow to the brain, it causes an ischemic stroke. High blood pressure is a risk factor for both hemorrhagic stroke and ischemic stroke. High blood pressure gives stress to blood vessels in the brain, and this stress can damage the vessel wall and build plaque that narrows the vessel and eventually block the blood flow to the brain. High pressure in the blood vessel also increases the risk of rupturing the vessel and bleeding to the brain. Aneurysm is a bulge in the blood vessel in an area of weakened vessel wall in an artery, which is very vulnerable to be ruptured, especially under high pressure. As we discussed, this rupturing of blood vessel and bleed in the brain is hemorrhagic stroke. Blood thinners such as warfarin, rivaroxaban, aspirin, and ibuprofen is a medication that prevents blood clots in the vessel, which can decrease risk of ischemic stroke. However, blood thinners also can increase risk of bleeding by inhibiting aggregating factors in the blood. And this can cause hemorrhagic stroke under high blood pressure. Controlling blood pressure within normal level and preventing blood clots by taking both blood thinners and blood pressure medications as prescribed is very important. Now let's discuss about signs and symptoms of stroke and stroke management. Knowing the signs and symptoms of stroke is very critical in shortening the time to get appropriate care and recover and minimize the long-term sequelae. Remember the word be fast. These are the signs of stroke. B, the patient will experience losing balance and headache or dizziness. E, blurred vision on one or both eyes. F, one side of the patient's face will be drooping. A, one side of arm and or leg will be weakened. S, there will be trouble speaking. The patient may not be able to get words out or words will slurred. Lastly, time. Call 911 immediately when the first signs of possible stroke present. Calling 911 is greatly beneficial rather than driving to the hospital. This is extremely important to remember. This is the fastest way that you can reach the hospital and get appropriate care. The patient can be located with the best hospital that is equipped with stroke team, and the stroke team will take steps for treatment even before the patient's arrival. This will result in less cost, shorter hospital stay, and better health outcome. This is really, really important, so I want to emphasize one more time. Call 911 if you experience or if you see someone experience any one of the signs of stroke. This will save life, cost, treatment duration, as well as long-term after effect. Again, if there is a patient who are experiencing signs or symptoms of stroke, call 911 and keep a list of current medications with the patient, including non-prescription and prescription medications. If you have a high risk of stroke, it is good to have a medication band with you. Taking extra blood thinner can make the patient even more dangerous, especially if it's a hemorrhagic stroke. And on the way going to the hospital, a stroke team will be waiting in advance.
Now we will discuss stroke treatment. As we mentioned earlier, stroke treatment begins the moment emergency medical services arrive to take you to the hospital. Once at the hospital, doctor will ask you about your medication history and the time of symptoms started. Then you will have a brain scan called CT scan to determine the type of stroke. If it's an ischemic stroke and you get to the hospital within 4.5 hours of first symptoms, you may receive a clot buster drug such as alteplase or tenecteplase to break up blood clots and restore blood flow to the brain. Studies have shown that patients with ischemic stroke who receives rapid clot buster treatment are more likely to improve functional outcome and likely to have less disability or need for a long-term care in a nursing home. So it's really important to get the treatment as soon as possible. Other procedures such as mechanical thrombectomy can be performed to remove and open the blood vessels within 24 hours. If it's an hemorrhagic stroke, to control hemorrhagic stroke and bleeding, blood pressure should be controlled, and procedure or surgery may be used to treat blood aneurysm. If you're on a blood thinner, there are reversible agents available to stop bleeding. Now we will go into what to expect after having a stroke. The reasons why it's important to treat the underlying causes of strokes are: if you have a stroke, you're at high risk for another stroke. 1 out of 4 stroke survivors have another stroke within 5 years. The risk of stroke within 90 days of transient ischemic attack may be as high as 17%. Therefore, it's very important to incorporate treatment and lifestyle changes. Next, if you had an ischemic stroke or a transient ischemic attack, your doctor may prescribe medication to help reduce your risk of having another stroke. You may receive either antiplatelet or blood thinner medications. Platelets are cells in the blood that forms clots, and antiplatelet drugs such as aspirin or clopidogrel would help making less sticky and less likely to clot. Blood thinner drugs such as warfarin, apixaban, or rivaroxaban are used to reduce blood clotting as well. Now we'll discuss the recovery from stroke. Side effects are not always permanent and may take a while to regain physical function. But I'd like to emphasize that patients who receive such treatment as early as possible, symptoms can be completely reversed. Depending on the severity of stroke, patients can go back to living life as before the stroke. And you may also regain your strength by speech therapy, physical therapy, or occupational therapy. Now we will cover the stroke prevention. There are 8 steps to prevent a second stroke. Up to 80% of second clot-related strokes may be preventable, which can be done by monitoring your blood pressure, controlling your cholesterol, keeping your blood sugar down, getting active, eating healthier, maintaining a healthy weight, smoking cessation, and managing your medication. It's also important to take your medication just as your doctor has prescribed, especially if you're taking any antiplatelet or blood thinner medications. To reduce our risk of stroke, we highly encourage maintaining healthy body weight by incorporating DASH diet, which only a dash of salt with 1,500 milligrams of sodium per day. That's about 3/4 of a teaspoon. Mediterranean diet is also an option to lower fat in diet, which is consisted of fish and seafood instead of red meat, and olive oil as your main lipid source. Alcohol consumption should be limited to male is less than 2 drinks per day, female is 1 drink per day at the most. Healthy lifestyle modification is also highly encouraged. You should quit smoking to reduce the risk of stroke, and exercise or being physically active should be reinforced by incorporating moderate intensity aerobic activities such as walking briskly, water aerobics, bicycling, or general gardening. It's important that during the moderate intensity exercise, you're able to talk but not able to sing. Vigorous intensity aerobic activities such as race walking, jogging, running, or swimming laps. During this exercise, you should not be able to say more than a few words without pausing for a breath. Muscle strengthening or stretching 2 days per week is also highly recommended. For balanced exercise, 3 days per week may be an option if you have a risk of fall. For more information on stroke, or if you have any further questions, please visit these websites or contact American Heart Association or American Stroke Association down below. And this concludes our webinar. I hope you found this webinar helpful. Thank you so much for your time.